jump in and take control and move fast and be dynamic.
Act now. Be a leader. Take charge. Action, suspense, and thrills add drama, but they don't necessarily help you make the right decision. The next time you're pushed to act fast, you might want to take a breath instead.
Shooting from the hip and, just doing the first thing that comes to mind. You got to take a breath. Don't just do something. Stand there.
This is Mark Wojcik, and I'm wondering, how's your so-called career? Welcome to So-Called, the podcast that explores the why and how of work. On today's episode, we meet Jim McColly, Physician Assistant at the VA in Boise, Idaho. I asked Jim to describe what it means to be a PA and what he enjoys about his work.
So a physician assistant practices medicine under the supervision of a physician, although it's a little bit of a misnomer because we actually have our own patients and we are responsible for all of their care. But if something's too complex, then we have someone we can go to ask for help.
What do you enjoy about the work that you do?
There's a couple parts, which is sort of the pat answer of, you get to help people.
Yeah.
Which is okay. It's
That's all right.
It's nice when it's successful. The part that's interesting and fun, on the medicine side of it anyway, is helping a person understand their current physical challenges or health challenges, and then trying to give them some goals to work toward, and then figuring out an angle to get them motivated to do that thing. Asking someone, what's the barrier to you eating less? What's the barrier to you getting some exercise? Or what would motivate you to help quit smoking? What in your life are you not able to do now because you smoke or because you do X or Y? And then trying to find those things on that, it's going to motivate that individual. But the second part that I really enjoy about the work is sort of the human interest component, where I learn people's stories. I learn how they've lived their lives, what they've done, what kind of work they've been doing, and their personal lives, their health, not just their health histories, but I get to know pretty much everything about them in a far more intimate way than they might know, or than their family or friends might even know.
Sure.
And that doesn't mean not just in a physical sense, but in terms of what's going on in their head, what their concerns are, their worries, their anxieties, their regrets. I don't know if it's holistic, really. It's like if you go to an urgent care, someone will, you go in with a little thing, someone will fix it, and they're out the door. You don't really get to know them. It's just there's a foot in room 3 for you.
In addition to finding the right motivations for his patients, Jim enjoys learning their stories.
I really like the contact with the patients. Getting to know their stories is fascinating. Getting to kind of know. This sounds weird, but kind of just the human experience. I mean, people come in, they tell me things they may not be telling anybody else. Yeah, maybe they are, but I mean, it's, I get this concentrated slice of time to learn about somebody's life. And so over hundreds and thousands of patients, you hear all these interesting stories of different things people have done. So people have, it's you can't call it when they come in the room at all. It's you cannot guess a book by the cover. Once you find out their stories, it's amazing. It's fascinating. So that part's great.
Yeah,
that's really fun, and it's really satisfying when I do actually make that connection with somebody and find the thing that's going to help to motivate them to be a little bit healthier. And people always tell me they want to get off medications, but people rarely want to take steps to make that happen. But when I can finally get somebody to that point, and it's like, hey, you don't have to take your blood pressure medicine anymore. Hey, you can back off on your diabetes. But I mean, those things are great. Or they've lost 1 pound or something like that.
Sure.
Those are fantastic. Those are great.
While helping patients reach their goals is satisfying for Jim, it can be challenging to get them to reveal enough information so that he can help.
Less enjoyable parts are knowing that people lie to me all day. And maybe it's too dramatic to say that they lie to me all day. See somebody after a 6-month recheck or something, and the plan was to do a certain amount of exercise and a certain amount of cutting back on their portions, and they go, oh, well, we talked about this, that, and the other time last time, and how did that go? Well, I'm trying. Okay, tell me about trying. It's like, well, I've thought about it. Okay. Thinking is the first thing, and just they backpedal, where eventually it's, they didn't do anything.
Yeah.
And then you have to try to figure out why. So sometimes that'll wear you down some days. The other one that's a weird one is getting people's histories. And this is a particularly difficult thing with men, is they will withhold information about their history and wait for me to ask the right question to discover it, which I've never been able to figure out why that is. So they have the information, they know it, like, could be something like they have high blood pressure that's never been treated. And I'm asking them questions, and have you had any health problems? Have you ever had anything been treated before? This, that, the other thing, whatever. Well, have you ever had hypertension? Oh yeah, hypertension. And up to this point, they haven't given me anything.
Yeah.
And I don't know that is a complete mystery.
What does medical practice have to do with sales skills? You might be surprised.
I'm really good at getting a history, despite the obstacles. I also used to work in sales, so finding basically what the customer's needs are, and then to do what I have to offer. Can I fit it to those needs? I learned how to do that in sales, and so in medicine, it's a similar thing in terms of history taking, where I'm trying to drill down to get that information from somebody, and I feel like I can build rapport with people pretty quick, and I pay attention to what they're saying while they're in the room. I mean, I can for 20 minutes I can pay attention. So, but
that seems like an asset.
Yeah, and do all the stuff that sales guys do. Make eye contact, repeat their name. Just a lot of affirmations, nodding your head, all that kind of stuff. So I'd say that's something that I think I do well.
Establishing rapport with patients is something that comes naturally to Jim. Knowing when to hand off a case to a specialist has been a learned skill that he's had to work at.
It's difficult to know or to learn when to say uncle on something like that, in terms of, okay, this is beyond what I have either experience with or I'm comfortable with, and learning to say that. I've learned to do that. I wasn't as comfortable with it when I was a newer PA, because in school we're taught to do everything for all the patients. That basically we can do anything that any other practitioner can do as a physician assistant, and it's true, because PAs work in all kinds of specialties. But if I've always done family practice and general medicine, so I've got a broad knowledge of a whole bunch of different stuff. But if we're going to, like when I used to work at a family practice place, some of the pediatric stuff, it gets complicated real fast if you go into the more, kind of a more specialized problem.
Yeah.
And you sure don't want to mess it up. So I finally got comfortable saying, you know what, I'm not going to take you any further on this. I'm going to refer you to somebody out. I'll do the follow through afterward. But as a student, you develop the habits that are going to carry you into your practice, and you need to recognize the habits of a student and the habits of a provider in practice. And they're different. There's some similarities. Some of the mechanics are similar, but some of the decision making and when to pull in other people's help. As a physician assistant, what's called my scope of practice, or the stuff I'm allowed to do as a provider, has a limit. Whereas if you're a doctor, based on your licensing, you really don't. But I would argue that, most of the docs I know kick stuff to the specialists too, because nobody knows that one. Nobody can be an expert in everything. You do it at your peril.
Yes. As I say about the lawyer, you don't want to be your own lawyer.
Absolutely.
Kind of the same.
That's why you shouldn't, as a provider, you shouldn't see members of your family. You're not going to make a good decision. Or treat yourself. You just wind up taking a bunch of narcotics all the time.
Yeah, that's right.
Because that's the best medicine of all.
Yeah. And, I think everybody can relate to not wanting to see their family. Under any circumstances.
Exactly.
But much less the
Precisely.
medical.
Absolutely.
Jim's path to becoming a PA was different than most people in the healthcare profession, and I asked him to discuss his background and how he got into medicine.
I had an undergraduate degree in English and writing, which led me to work at the mall and drive a pizza truck. So that was a pretty enriching experience. But I ultimately kind of worked my way into sort of the first real job was as a student recruiter for the College of Idaho. So the goal was to try and bring him in. So I learned some sales stuff and a little bit of, how people make decisions and those sorts of things with that job. Then went in and worked as the development director for Planned Parenthood of Idaho for a couple of years. Then that kind of got me into the fundraising track of things. I mean, then that job was pretty straightforward. People either were for you or against you. And if they're for you, they're going to give you money. If they're against you, they're not. And then wound up working at Boise State Public Radio as their development director. And then that was more of just a traditional nonprofit fundraising job. But after I was in that job for a while, I started to realize that I did not want to do that job for the rest of my life. Mm-hmm. And it wasn't burned out, but could see it coming. It's like looking on the horizon. I'm like, man, in 10 years, I'm really not going to like this job. So I got a copy of What Color is Your Parachute?
Okay.
And went through that whole thing and looked at my strengths and weaknesses, or however, I don't remember how it was phrased, but things I liked, things I didn't like. And I realized that one of the things I really liked about my development job was the part where you interview somebody about their marketing goals or their charitable goals or that kind of thing, get to really know what that is and say, okay, is there a fit for us with anything that we have on our side of it? And I found that a lot of businesses, even though they wanted to have a spot on the air, didn't really know what they wanted to say and couldn't even explain why anyone should come to them. Places around town that you've seen for years, they really can't articulate what it is they do. So that's where the real history and digging out of, what is it you do specifically better than any? And they had stuff.
Yep.
They just couldn't articulate it very well. So anyway, that is sort of what led to medicine. Because the skills of that, taking that history and that interviewing, and then linking somebody up with their needs, in this case, they'd be marketing needs, and in healthcare, it's your health needs, and then figuring out a way to link all that stuff together for somebody. I have the knowledge and the resources to help you solve your problem. So that's the part of it that I thought, well, I could do that.
Yeah.
And then the medicine part of it was, weirdly, I heard a little snippet of Terry Gross on Fresh Air was doing an interview and with some doctor about something. It was about the inflammatory response. And it was so fascinating. I was just like, that is amazing. The mirror, the body, the cells, they come to the defense of the body and all the things that are happening. And I thought, wow, that's really cool. And then later, I don't know, sometime around that same time, there was, we had a couple of dogs, and for whatever reason, those dogs didn't get along and they'd fight each other. Mm-hmm. And the two of them got in a fight once, and one of them had a pretty serious injury on his leg. I was like, okay, we're going to put a compress on the leg, whatever. And I just sort of, I sort of triaged the situation and basically just set everything aside to like, we got to get this done. I had to calm her down, get her focused, okay, you're going to drive. I'm going to hold the leg, or we're going to go to the vet. We're going to do, all this kind of stuff. And I thought, maybe I could do medicine.
Yeah.
I can step outside of the emotional part and just, troubleshoot the problem. Sure. And then we can freak out later.
Yeah, that can happen later.
But it's like,
right now.
Yeah. So anyway, so then I at the time was working at BSU. And so I was able to take classes and such. And I said, well, I'll sign up for anatomy and physiology, which is sort of the cornerstone to the medical education. And I said, I'll take that. And if I can I get a B or an A, then I'll keep going and see if it works out. And I did well with the help of a study group I got with, and I learned a whole different style of study habits than what my liberal arts education had prepared me for. Not that was a bad education, it's just different. In the sciences, it's black or white, right or wrong. There is no wiggle room. In the liberal arts, it's a lot more interpretive.
Were you at all surprised when you started thinking about medicine? Would that have ever been anything that you imagined was an area you might go in?
Never in a million years. Yeah. It was very surprising when I sort of looked at the things I liked about what I did, and then what kinds of professions used those skills.
Yeah, it's a good thing to know what you don't like to do, but it doesn't really tell you much about what you do want to do or what you should be or could be doing.
Yeah. And it's really easy to identify the stuff you don't like.
Yeah.
You tend to ignore, or I guess not give enough credit to, the things that you do well or that are easy for you, that may not be easy for other people.
Yeah.
So it came natural to you, but other people have to work really hard at it. So that might be a great area to find that whatever links up with it.
Does the background that you had give you any advantages in any way as you approach your practice now?
Well, patients have told me anyway. I know this because
with that, yeah.
I know patients have told me over the years that they go, wow, I really like how you've explained that to me, in terms of whatever their condition is or what's happening to their, what is hypertension, what is diabetes, or what does this medicine do, or whatever the thing is. Not using the medical jargon, not using medical terminology to explain something, but trying to break that down in a way that's more accessible to people who haven't been in medicine their whole lives.
Over what period of time was this? So you mentioned you kind of realized this is not what I want to be doing for the rest of my life. You do some research, and then you start taking some courses, and then how long was that?
I'd say it's about 2 years.
2 years, and then school is?
Getting ready to go to PA school was 3 additional years.
Yeah.
So there's 3 years of taking the prep courses and then getting the work experience I needed, because they required some kind of medical experience. And so I talked to some PAs. I also should say I shadowed a PA before I made the big jump.
Okay. Yeah.
I went and just found a PA and followed her around all day to see what is this work like, and then walked out of there thinking I can totally do this. The parachute book was the first phase of it, and then the second phase was, okay, well, if I want to be a physician assistant then, and looked at all the programs and looked at all the requirements and figured out, okay, what is the qualities of their dream candidate? If they have a tick list of things, person has to have this, that, the other thing. What are all those things? And then I set out to become that thing. Put your ego on the back burner, and it's all about the goal. So 2 years to make the decision, 3 years of preparatory coursework, and then PA school is 2 years.
Yeah. Okay. So a long haul. Jim had to do a thorough diagnosis not only to determine what career he wanted to pursue, but how to make that path a reality. Making such a dramatic change didn't come without some risk. How big a risk was it for you to make the career change that you did? And when you did it, maybe too?
For me, it was quite risky in that there was no plan B. However, having no plan B made me very focused and work extremely hard and be much more disciplined student than I ever was at any other time in my life.
Yeah.
I quit my pretty sweet development job, and in Boise at the time, it was one of the top 2 or 3 development jobs in the city. So I walked away from that. By the way, that's a massive demotion. I mean, it's like I go from being like the number 2 or 3 guy at this public radio station in Boise, and at the time, I mean, we were lots of people listening to us. It was people thought it was a really cool job, and this and that, paid pretty good benefits, blah blah blah, to being the lackey with a group of ophthalmologists who, barking orders at me all day, and I'm running through the file room. I mean, I'm the lowest rung guy there, and I can barely keep up with the job because I've never worked in medicine before. So that was that was rough.
But I'm guessing for you, the job title at that point probably didn't matter that much.
No, not at all.
It was the work that you were doing that was the meaningful part. Who influenced your thoughts and attitudes about work, how you approach work, career?
There was a doctor I worked with for 5 weeks in a small ER, and this he was always very calm under pressure, and there wasn't a whole lot of pressure at this. I mean, it's a rural ER, so you don't see a whole lot of stuff. But anyway, we had a guy come in one time, and he was having a heart attack, or his heart wasn't quite a heart attack. It was moving toward that. The doctor who was running it was basically observing the patient, observing the readings, and the nursing staff at this particular situation wanted him. They kept telling him, shock him, you got to shock him. We got to, give him, like in the movies, you rub these things together and you boom, put him on the chest and bam, to realign the electrical pulses in the heart. He's like, no, we're going to wait. Just, we're going to observe in the patient. Anyway, so basically this guy's bottom line was, don't just do something, stand there.
Yeah.
So, which is one of my favorite lines of all time, because it was his model for how to approach these situations is, and that really is the cornerstone, I think, of the medical practice is we're trained to be calm and to not jump at the first thought or to think these things. I mean, somebody who isn't in medicine and they're having an emergency, they don't see that every day. They're not trained in it.
Interesting. I think good advice. I think especially good advice in medicine, I'm sure. But in overall, right, there's often don't just do something, stand there.
Yeah, and it's the opposite of what you, unfortunately, is modeled in most movies. Jump in and take control and move fast and be dynamic and blah blah blah. And it's like, really no. It isn't. Shooting from the hip and just doing the first thing that comes to mind. It's not always. I mean, it might be the right thing, but you got to take a breath and tincture of time. That's another thing. A colonel I learned from another guy who's a rural medicine guy. He's like, he said, number one, he said, when you have a patient come in and they have 10 problems, you're not going to fix them all today. Pick the 2 most important problems. You can talk about them all. But, if you try and fix 10 of those, you're going to make, inevitably, if you give them 5 medicines, you don't know which one worked. You don't know what the interact. Anyway, you're not going to fix it all in one 20-minute visit. So you got to learn to prioritize that stuff. A lot of stuff gets better by leaving it alone. So say, well, let's see how it is in 2 weeks. You can't do it for everything.
Yeah, sure.
But if it's kind of a borderline thing or it's a brand new thing, I mean, you can spend a lot on different tests and pills and all kinds of stuff. But when I was working in a rural clinic myself, and the patients didn't have insurance and they couldn't afford all those tests, it was really driven into me that a lot of stuff just gets better.
Yeah.
Not because I did anything. They just get better or go away. Okay, well, great. If it comes back again, then come see me because I don't have a pattern. But otherwise, you're good to go.
Yeah. Did the career move that you made to become a PA, did that provide what you hoped that it would provide in terms of your work or satisfaction with work?
Yeah, I would, very much so. At the very least, I either help to improve and occasionally save people's lives on a fairly regular basis. I mean, it's not that dramatic, like, they're jumping off a cliff and I grabbed them, but it's like, if I can make them healthier, I've added years. That stuff is weirdly easy to forget because the job is like any job where you do it often enough, you kind of just take, this is what I do, so that's the gig. Well, it is very rewarding, I guess, is the bottom line.
Is there something bigger that you're trying to do, maybe outside of work or beyond work? Or is there a next big thing that you're looking to tackle?
I guess I'm kind of tackling it now. In medicine, it's fairly common for doctors to become managers or for RNs to become managers, but it's not very common for PAs to become managers. So I've moved into a part-time role with management, a little bit as a stretch for me, but also to be a little bit of a standard bearer for my profession to show, hey, you can hire PAs to be managers. There's nothing holding you. There's nothing against that. There's no rule that says you can't do that, but it's not what is done. It's sort of a glass ceiling situation. And until people see people in that role, I think until leaders see people in that role, it just doesn't occur to them that it's even a thing they could do. So that's my kind of my stretch thing, and we'll see how I like it. And it's a mixed bag so far.
Knowing what you know now about your career and life lived and so on, what advice would you give your younger self?
Well, I'd go back to my younger self in high school and advise myself to sort of, I guess, broaden my base, get a little more out of my comfort zone. Because I basically did in college what I was always good at in high school, which was writing and English stuff. I always got a lot of praise for that, and it came really easy to me. So I just kept doing that. Maybe a shorter way of saying it is just broaden the horizon. Leave yourself open to more diverse set of paths than just that one narrow thing that you're good at.
Yeah.
And comes easy because you never have to really work that hard to be good at it. Well, and you don't learn how to, at least for my case, I didn't learn how to really study until I had to go back to school. I just didn't have the skills. I didn't know how to do it. I knew how to do my one thing.
Yeah. Okay.
I had that, I was the one trick pony master of, writing a paper overnight and, pulling that baby out of the magic bag, and it would come together somehow. I did that over and over and over and over again. But getting away with that makes me, very, very narrow in my skill set. So that's not a good thing.
Yeah. Do you have any advice for somebody who's thinking about making a career change?
The research is critical. You absolutely positively have to at least talk to people who do that job, and more than one is better.
Yeah.
And if you can, join them on the job. The other one is take a look at what's the marketplace like on this. I did research with the Bureau of Labor Statistics and looked at what jobs were on the grow in the future.
Yeah.
Not as sort of, I'm going to pick one of these, but are any of these interesting? Or is this anything?
Well, because it's good. I mean, it's like, I'm interested in this. Is there any market for this?
Yeah.
Yeah.
I really love making buggy whips. It's the best thing ever. I want to keep on doing that. I mean, weirdly now you probably could.
Yeah, you probably could now.
Enough,
that and mustache wax.
Yeah, mustache wax and artisanal buggy whip making. You just have to live in Brooklyn, I guess. But anyway, and you certainly wouldn't have to choose something that's going to be in one of the top 10 growth jobs or something. But if you actually match up with one of those things, then it's like, well, okay, that's nice to know.
Here's one last piece of advice that will help no matter what field you end up pursuing.
One thing I've learned in medicine that my patients keep telling me is like, they say, thanks for listening.
Yeah.
That's it. All I did was, how hard is that? I didn't even have to go to school, right? I mean, I could have faked the whole thing and just listened to the person. It's like, because they've done studies on how quickly a provider interrupts a patient when they come into a room.
Oh, yeah.
And it's I think the number is 7 seconds. 7 seconds. It's insanity. Let the people tell their stories, and then you can start to formulate stuff.
What's ailing your career? Maybe it's time for a checkup to diagnose the best fit for you. Jim McColly did the research to build a more satisfying career for himself, one that better utilizes his natural talents and that stretches him to build new skills. Whether your career is your passion, a paycheck, or a pain, I hope today's episode has informed, inspired, and challenged your own relationship with work. Thank you for listening, and stay tuned for more episodes of So Called. If you enjoyed today's episode, please let us know. Subscribe and leave us a review. So Called is available on Apple Podcasts, Google Play, and wherever you get your podcasts.